Right, completely changing the subject from breast to something a little bit more manly. Rugby and football, the real man's game. Well, rugby anyway. Well, we all know that they're pretty rough sports and injuries are just part of the game. I managed to probably play rugby for about 16 years, get away with broken rib, pulled hamstrings and a missing tooth, which actually happened after I had braces, so you can imagine my mother wasn't too impressed. Now today I've brought a My Face, My Body expert, Richard Brookshaw. Richard is one of the first dentists in the country to be awarded the highly acclaimed diploma in implant dentistry from the Royal College of Surgeons. Welcome, Richard, to the show. Sort of what percentage of males now are coming into your clinic to seek the correction of their teeth?
I mean, things haven't changed an awful lot in terms of attendance at a dental clinic for the last 10, 20 years. There's always a 60-40% split, so with more women going than men. And that stays the same whether you're going for checkups, routine care, or cosmetic procedures. It's the same all the way through.
Are men a little bit more reluctant to go to the dentist, do you think?
I think the figures show that. I think it's becoming more common now for guys to attend for cosmetic type procedures, whether it's dentistry or fashion or facials or whatever. You know, it's becoming more part of our makeup, and there's maybe an Americanization of how we see the teeth as well as the rest of our healthcare.
Yeah, I mean, because we've got a fantastic, obviously, before and after photo, which is you'll see on the screen there. I mean, can you explain sort of what they had done?
I mean, it just shows basically somebody who's missing a tooth from when they were 17 until they were 36 years old and had a denture the whole time. Otherwise, an intact mouth with no problems at all. A person who looks after themselves very well, but put up with this denture for a long, long time, which impacted on their social and psychological well-being. And they went through the implant procedure, and as you can see, it gives them a fantastic standalone solution now.
Is it a simple procedure?
It's a fairly straightforward. It's a local anaesthetic procedure. It's not awfully invasive. It's something I'd have done and go back to work the next day type thing. A little bit of bruising, a little bit of swelling, but nothing dramatic.
I mean, I had a dental implant, God, it must be about 12 years ago now, due to not wearing a mouthguard, not very good. But I mean, has technology progressed over the last 12 years?
I think implant dentistry has been around for 40 odd years, in the modern form. And the implant systems have progressed as everything progresses in technology. There's loads of technology involved in implant dentistry as well as other forms of healthcare. But the thing which has improved most recently is the adaptability, the impact of technology on gaining the perfect sort of aesthetic result, and that's what we're really about now. Implants work. We know they're going to work. You know, success rates are almost 100% for implants. So really it's about it looking good rather than whether it's going to stay in your mouth or not.
Thanks, Richard. After the break, you'll find out if men can really save their hair by standing on their head for 10 minutes a day. We will be revealing our celebrity guest and show you how to enter our show competition. We'll be right back.
The stem cell facelift is a groundbreaking technique in facial rejuvenation. It's a non-surgical procedure which involves recontouring the face or breast using fat mixed with stem cells specially harvested from your own body. There is no need to go under the knife in order to roll back the years. It's a safe and simple process, there's no scarring, and you get a natural appearance with none of the downtime associated with a traditional facelift. Backed by clinical research and using an FDA-approved cell harvesting technique, this brand new procedure is a fast, effective and relatively painless alternative to the surgical facelift or breast enlargement. Dr. Arma Khan of the Harley Street Skin Clinic is credited with carrying out the first stem cell facelift last year, with amazing results, and it's fast becoming the most requested procedure at his renowned Harley Street practice. To book a consultation with Dr. Khan at the Harley Street Skin Clinic, visit www.harleystreetskin.co.uk or call today on 020 7935 0986.
Rhinoplasty, nasal shaping, or nose job is one of the most common cosmetic surgery procedures. At London Bridge Plastic Surgery, our patients have a very good experience following rhinoplasty, which boosts their self-confidence and body image. The rhinoplasty procedure is carried out under general anaesthetic as a day case or overnight stay, and usually takes 1 to 1.5 hours. The recovery time following a rhinoplasty is 1 to 2 weeks, but the full effects and the benefits of the procedure are not usually seen before 9 to 12 months. Because we recognise that many patients are not willing to undergo a full surgical procedure, we also offer a non-surgical nose reshaping using injectable products for these patients.